One of the questions that patients ask us is the difference between the bridges that fit on implants that we're basically using with teeth on for. So we have essentially two different types of bridges that patients are able to have. The first bridge is called a provisional bridge, and this provisional bridge is essentially made usually on the same day of surgery. So one of the main differences between the provisional bridge and the permanent bridge is the fact that there is a metal frame that actually fits inside, okay? This frame is essentially something that provides rigidity within the actual implant bridge. And what's important, and the essence of what I'm trying to explain today, is that this bar, which is made in one of two ways, it can either be a casting process, meaning that we have to design this first in a specific type of wax, and this wax is then using what's called a lost wax technique. It's actually then processed from a wax to a metal. So this metal frame essentially is going to provide the rigidity for the definitive bridge. Unfortunately, it's not as straightforward as one would hope or think to cast this, because as you can see, these are very, very small little openings within the bridge, and because we're working with very small tolerances and very small screws, this has to be very, very accurate. Problems that we face when using a casting method is that in order to actually change this into metal, the metal needs to be heated and melted at over 1,000 degrees Celsius. So during that temperature increase, the metal actually expands, and once it cools down, it actually distorts. So that distortion, unfortunately, is always going to be present during a casting process. So in laboratories, they've tried to move away from the casting process for quite some time because it introduces a lot of errors and inaccuracies. We use a very ingenious, if I could say, method, in that this is actually done in two phases. And in this way, we can basically reduce the negative distortion effects of how this is cast together. So this is done in one piece, okay? And this piece basically then gets bonded to what are known as small interfaces, and these interfaces then fit on the abutments. So any errors that are introduced during the casting process are basically cancelled during this bonding process, because there is no pressure or no distortion within this frame. Essentially, you want these components to fit so precisely together that the holes and the screws fit without any active pressure. The active pressure is non-desirable because it will create a strain on small screws and the bridge itself. So that's basically the technique that we use for making bridges sit accurately and what's known in dental terms passively on implants. One of the features of this metal bar essentially is that it has some retention for the material to actually adhere to, and basically that will ensure that the bridge is as strong and as robust as possible. This bar actually is then embedded within the bridge. So if you look at this example over here, the bar is actually embedded inside here, so it's not actually seen, and it's basically covered with material within the bridge all around. We find this technique works very, very well for us in terms of providing a very strong long-term solution for patients.